A patient has frequent urination, nighttime urination, bedwetting. Test shows urine volume in 24 hours is 7 liters. Urine osmolarity is 260 milliosmolarity per liter. ADH level is 0.8 picogram per ml, and in MRI brain, posterior pituitary bright spot is absent. What is the most likely diagnosis? Correct answer is option C, pituitary diabetes insipidus. Low ADH level means less hormone is being produced. Absent bright spot on MRI shows pituitary problem. This confirms pituitary diabetes insipidus. A patient develops difficulty swallowing, hoarseness of voice, vertigo, and loss of pain and temperature sensation following thrombosis of the posterior inferior cerebellar artery. This condition is most likely associated with The correct answer is option A, lateral medullary syndrome. Thrombosis of the posterior inferior cerebellar artery causes lateral medullary syndrome, also called Wallenberg syndrome. A patient is suspected to have esophageal perforation after developing severe chest pain and difficulty swallowing following an endoscopic procedure. Which contrast dye is preferred to confirm the diagnosis? Correct answer is option A, gastrographin. It is preferred because it is a water-soluble contrast agent and is safer if leakage occurs during esophageal perforation evaluation. All of the following are important components of the countercurrent mechanism in the kidney, except The correct answer is option C, sodium outflow in thin ascending limb. In humans, the thin ascending limb is mainly impermeable to water and does not effectively transport sodium. The major active sodium transport for the countercurrent mechanism occurs in the thick ascending limb. Which organ is the major site of production of insulin-like growth factor 1 in the body? The correct answer is option A, liver. The liver is the main organ that produces insulin-like growth factor 1 in response to growth hormone stimulation. A newborn is diagnosed with ventriculomegaly on neuroimaging. What is the most common cause of ventriculomegaly in newborns? The correct answer is option D, aqueductal stenosis. This condition blocks the flow of cerebrospinal fluid between the third and fourth ventricles, making it the most common cause of congenital ventriculomegaly. A newborn presents with ambiguous genitalia due to congenital adrenal hyperplasia. How does this condition most commonly present? The right answer is option B, female pseudohermaphroditism. In congenital adrenal hyperplasia, excess androgen production causes realization of a genetically female infant, leading to female pseudohermaphroditism. Under the revised National Tuberculosis Control Program organizational structure, which is the most peripheral healthcare unit? The correct answer is option D, Designated Microscopy Center. The Designated Microscopic Center is the most peripheral unit where a sputum examination for tuberculosis diagnosis is performed. The CHADAC committee recommended all of the following except The right answer is option B, 1 PHC for 50,000 population. The CHADAC committee recommended integration of malaria services with general health services but did not recommend 1 PHC for 50,000 population. A child is diagnosed with Sprengel deformity, a congenital elevation of the scapula. Which of the following is not commonly associated with this condition? Correct answer is option C, dextrocardia. Sprengel deformity is commonly associated with Klippel-Feil syndrome, congenital scoliosis, and spinal cord anomalies like diastematomyelia, but not with dextrocardia.